Hi, it's Dr. Frisella. I just wanted to make this video to update you on where things are with COVID-19 and orthopedic practice and orthopedic injuries. Uh, Today is July 13th, and a lot has happened in the last few months. Cases went way up, then they went down, and now cases appear to be increasing again. What is important to understand is that where I practice and in St. Louis, the St. Louis area in general, the number of hospitalized patients is still very low. So although the number of cases by testing has increased, the number of patients in the hospitals where I am doing surgery is very low. So that's important to think about for me when I think about what's safe to do and what's not safe to do. Um, Overall, if you are going to come in and get orthopedic care, what do you need? Well, you need to see the doctor. You might need to get x-rays or an MRI. You might need to have treatment, things like physical therapy or medications or even injections. And occasionally you have a problem that might need surgery. So where are we with all of those things today on July 13th? Well, first of all, you can come in and see us. You can see the physician. You can see a nurse practitioner. You can call in and get an appointment. We're still doing appointments by telehealth if you're more comfortable that way, but most of the patients are coming in and being seen just like normal. Now, you're going to see me wearing a mask when you come in and see me, and we're also going to ask our patients to wear a mask, and that's just to protect each other from transmitting the virus if we don't know we have it, for instance. Because when you're seeing a doctor, you're often going to get pretty close as we examine you, and so we want to minimize that contact and want to keep you safe. Now, what if you need x-rays? X-rays are available. We're doing x-rays in our office. Again, we're going to have you wear a mask, and our tech is going to wear a mask. And what about if you need an MRI? So some problems require an MRI. An MRI is still available to you, and you can get an MRI. Injections and physical therapy. Therapists are still seeing patients in person. Some therapists are doing telehealth visits, but most of them are still doing them in person. And then finally, what if you need surgery? Well, elective surgery, that's things like shoulder replacement, rotator cuff repairs, biceps repairs. Those surgeries are happening right now, both in the hospital and at our surgery center. So as things stand right now on July 13th, you can come in and be evaluated for your orthopedic injury, and we can do everything we need to take care of you, from seeing you to getting x-rays to getting an MRI to getting therapy, medications, injections, or even surgery if that's necessary. Now, we are going to keep a close eye on the number of hospitalized patients, and it is possible that elective surgery will be shut down. That is happening in some places in the country, so we're keeping a close eye on that. But in general, right now, although we're keeping an eye on this increase in cases, and we're thinking about that, and we're thinking about how many patients are hospitalized, at this point, you can be cared for your orthopedic injury from beginning to end with no problem. And the only significant major difference is we're going to all be wearing masks while we're inside. Thanks. Hope that's helpful.